Hi everyone, welcome to this TechNet 21 webinar series on capacity development and professionalization. Let me give you a little bit of video before we start. My name's Dan Brigden. I work for WHO here in Geneva on the vaccine supply chain and logistics team. Our regular community manager, Alex Pascuto, is on contract break this month. So you've got me, unfortunately, and I hope I don't make any mistakes as we go along. And as I'm also a presenter, you're going to be hearing from me quite a bit over the next hour. So before we begin, I'm going to say a few words on how you can get the most out of this Zoom call. Firstly, if you prefer, you can listen to this presentation in French. To do so, just select the globe at the bottom of the Zoom window and choose the desired language. Also, feel free to use the chat box to introduce yourselves, tell us who you work for, and let us know what interests you most about this webinar. And if you need any technical support as well, please let us know in the chat and we'll do our best to help you. If you have any questions for the presenters, you can use the Q&A box available at the bottom of this Zoom window at any time. But our panelists are going to go through them primarily at the end of the session, where we're hoping to have time, dedicated time to answer Q&As. So this session is being recorded and is going to be shared on the TechNet 21 YouTube channel. Early next week, we'll send an email invitation to everyone who registered with a link to the recording, as well as a link to the slides presented. So this webinar was originally scheduled to take place in December, but unfortunately, we had to postpone it due to unforeseen circumstances to today. This is actually the final webinar in the series and is going to be focusing on the effective vaccine management EVM assessment tool developed by WHO and UNICEF. The webinar is going to take about 60 minutes with approximately 45 minutes for presentations and 15 minutes for Q&A. We have 3 guest speakers, myself, Srihari Dutta from UNICEF, and Olamide Folorunso, also from UNICEF. So let's get things started. So what's on the agenda for today? Let's stop my video so you can see. Okay, what's on the agenda for today? The first part is going to be me talking about how we can use the EVM tool to build immunization supply chain capacity at the national level. Secondly, Srihari is going to be talking about building the same ISC capacity, but at facility and individual level. And finally, Olamide is going to be talking about how activities that are being conducted by UNICEF and WHO to build EVM capacity at national level. So the first 2 will be talking about ISC capacity development, human resources, etc. And the third will be talking about EVM capacity itself. Okay, so I need to spend a couple of minutes before I get started just giving you a definition of what is EVM. I suppose the best way to describe it would be a global initiative to improve immunization supply chains, and it's providing the materials and the tools that countries need to assess and monitor their vaccine supply chains and help countries to improve their supply chain performance. But that's very vague. What does it mean in a little bit more detail? Well, you can see here the tagline, or the catchphrase, if you will, of EVM is setting a standard for the vaccine supply chain. What does that mean? Well, there are 5 specific components of EVM. And the first one is the one that's most important to our discussion today, but I'll define all of them for you so you can get the full picture. EVM is a set of standards that together define the optimal immunization supply chain. And there are something like 900 of these standards within EVM. We call them requirements, and I'll be talking about those in relation to capacity development in a moment. The second part is the questionnaire itself that is used to assess whether a health facility or a national immunization program meets those 900 requirements. And the third part and the fourth part are the administrative tools that we use to conduct that assessment. Thirdly, it's a secure website that's used by managers of individual countries to create and manage EVM assessments and analyze which standards have been met at national or subnational levels. And fourthly, it's also a mobile app. What is the mobile app? Well, it's the tool that we use to collect data to assess health facilities. Nothing more than that. It's our data collection tool. And finally, some might even say, most importantly, EVM provides an improvement planning tool that can be used to develop a continuous improvement plan based on the assessment findings in order to improve the national immunization supply chain. All of these tools are embedded in what we call the continuous improvement process, which expressed in this round process, which represents a narrative. It's just dividing the EVM process into four sort of discrete steps. The first is the assessment of the supply chain itself, which is created using the website and then delivered using the data collection tool to create that assessment and collect the data. The second part is the planning process, which is to make the improvement plan itself. The third part is to implement the plan, which is to improve the supply chain. And finally, the monitor phase is to ensure that the plan is working, to monitor the implementation of the plan and measure the progress towards the outcomes. And I mentioned earlier that the continuous improvement plan could be said to be the most important part of the whole process, because the improvement plan is how a country is able to improve its national immunization supply chain. And EVM is the fuel or the energy, if you will, that provides the findings from 900 requirements to enable that improvement plan to be comprehensive and the most effective it can possibly be. Now, how do we get from the start of the EVM journey, which is the preparation phase, to the very end of the process, having implemented our improvement plan and monitored it? Well, the bad news, or perhaps the good news, is that I'm not going to be covering this today because we don't have time, and I've already covered it in an earlier webinar series that took place last year on EVM, and we've gone into a lot of the details, so I'll be happy to share the links to that webinar series with you if you want to know more. If you want to get your hands dirty and start creating EVM assessments yourself, you certainly can do, not just as a national not just at a national level, but as a subnational or as an individual facility level. You can also do that to test how EVM works. So I won't be discussing that today. I'll just spend this slide and the next giving you the broadest possible outline of this EVM creation. And that's that when we rebuilt EVM2 based on EVM1, we wanted to put countries in the driver's seat and make the phrase country ownership mean something. And how we manifested that was by trying to enable countries to assess any aspect of their supply chain whenever they choose using the EVM tool, not limiting them to a particular concept of a full national EVM assessment. Now, that full national EVM assessment does remain the global benchmark. And we don't change that because that is used as a benchmark across every country in the world. But beneath that, countries are free to entirely customize their assessments by type, range, sample, and scope to meet their individual needs. And if you're interested what that means in practice, type, range, sample, and scope, please take a look at our earlier webinar series or the EVM user guides, documentation and training material that I'll share the links for when I finish talking shortly. This is how it looks at the very highest level in terms of the process. On the left-hand side, the EVM manager, who is nominated for one country, uses the EVM website to create the assessment, assign individual locations that were going to be assessed to assessors. And then on the app, the EVM app that's available in all of the app stores, you can download it for free now if you wish. Just go to the App Store and type EVM Assessor. With this app, assessors visit the health facility and then collect the data and then upload the completed data. And then finally, switching back to with our manager hat on, the EVM manager uses the EVM website to review and validate and approve the uploaded questionnaires. The questionnaires uploaded by the assessor, finalize the assessment, analyze the results, generate the report, and download the CIP development tool. That's what it looks like at the highest level. Now, the EVM2 framework is what categorizes and organizes the 900 or so requirements that I mentioned earlier. EVM2 assesses 19 separate criteria. E1 to 9 is referred to as facility operations, and it's what the health facility does. M1 to M4, similarly, is facility focused, but it's focused on the management of a facility. And you'll note that the operations and the management of a health facility are separated to enable better analysis of how well that health facility functions. And then R1 to R6 is the national program management that's not necessarily entirely applicable to one individual health facility. So EVM is approaching the assessment with three separate kind of perspectives. And underneath that, there's a whole lot more detail, and I don't have time to go into it now, but that's the highest level possible. And this, which is called the heat map, I think some of you may already know it, is what we use to get the highest level understanding of an EVM assessment. What we're looking at here is the summary aggregated data for one country's EVM assessment. And it's made up of 45 assessments of 45 separate health facilities in this example. The red cells indicate performance that has been listed as under 50%. The yellow cells between 50 and 80, and anything above 80 is considered green. And if you look on the left-hand column, you see the EVM criteria, E1 to E9, facility operations, M1 to M4, facility management. And in the top row, the header row, you see the EVM categories. And if you're interested in these categories and criteria in more detail, please, I don't have time to describe it, but it's very richly described in our training material. So please go back to it. But in the bottom right-hand corner, you could see a composite score of 72%, which is, if you want to have a single score for your so-called composite score, then this is what you have. But we are going to be focusing on just a couple of these to talk about capacity development. So what does EVM have to say about human resources in the vaccine supply chain? Well, this is our column C4, and you can see that we are interpreting the human resources category according to each of our 13 criteria that's relevant to a facility, E1 to 9, M1 to M4. So these are our scores, and in this specific example, 81% is the total, which is the bottom score there, the aggregate of all. So overall, we can say that human resources in this vaccine supply chain is receiving a positive score. So it's well managed, well run. Although there are clearly some areas of below average performance, notably in M4, which is the supply chain performance monitoring, and perhaps the maintenance and repair. So let's look at this maintenance and repair in relation to human resources. I'm giving you a set of screenshots here of the functionality that's on the EVM website. And the behavior of the website is that if you're interested in any of these cells and the values underneath them, you click them and you'll find much more information. So you're essentially zooming from the highest level possible, which is this heat map, and the more you click, the more detail you're going to get. So let's click on 67%. we're going to see this. A chart of 1, 2, 3, 4, 5, 6, 7 individual requirements. They're all listed here. That is what EVM is, the applicable requirements that EVM is assessing for human resources in relation to maintenance and repair. They're all listed here. I'm not going to go through them, but you get the idea. And I'll also point out that these requirements may be top level requirements, meaning that there may be one or many sub requirements underneath. Let's go through them in more detail, but I'm not going to name check every single one. I'll just show you them to give you an illustration of the values that you can get. So under C4.1, staffing, under human resources, we have around, what is that, 20 or so requirements that EVM says a well-run supply chain needs to have. But not all of these are going to be applicable to every health facility, and some of them may be more important than others. So applicability and weighting is something to bear in mind when understanding these requirements. They are not equal. And for example here, requirement 242, building maintenance staff or services are available to maintain buildings. This is applicable at all levels of the supply chain, but it's weighted differently. It's regarded as being far more important at the primary store and the subnational store than the lowest distribution level or the service provision, the health facility level. This is how I'm giving you a flavor of how EVM is interpreting these things. And I hope it's sparking sort of questions or thoughts in your mind of how you can access these requirements and use them to come up with a really good improvement plan to improve, to build capacity at individual facility level or even at the national programmatic level. Likewise, C4.2 is showing our training requirements. There's about 10 there, 8 or 9. And in the knowledge subcategory, there's only 6, which is all about the knowledge of the facility staff at conducting these different tasks. Let's move on to supportive supervision, which is regarded as, which is known as M3. And just to remind you, we're talking here of supportive supervision at the facility management level. You can see here that our total for this facility is 85. So we would regard this as a very well, supportive supervision is receiving a very good score in this regard, although the financial resources necessary to conduct supportive supervision operations receives only a score of 20, indicating that there may be financial considerations to look at in this regard. Now, everything I've just shown you on previous slides, this list of the requirements here for C4.3, C4.2, and C4.1, you can find them all yourself and interrogate them at your leisure on the EVM website right now. You can see the link in the top there. Type in evm2.who.imt into your browser, and then in the menu, click Setting the Standards, and you'll see this page. This page is simply an interface that will enable you to view all 891 requirements that EVM says is necessary for a well-run supply chain, and you can filter them by particular categories or criteria, or combinations of category and criteria at particular level, if you want, in order to see those that interest you most. So I'm looking here at M3 supportive supervision, and this is what I'm going to see. 12 entries filtered from the 891. You can see them all here. This is the same information, the same type of information that I showed previously. But here there's a little bit more richer information. It's showing you the weighting of individual requirements and their applicability at different levels of the immunization supply chain. If you're especially interested in one particular sort of area or criteria or category, I would encourage you to filter what you're interested in and download. and then you can go through it in full details offline at your own leisure. But if you are interested in viewing on the website, you can click the little eye icon here, and then you can see much more information about that requirement. And you can also see associated resources, WHO or UNICEF or partner guidance publications that may be useful to you in better understanding that requirement and gaining more guidance around it. Okay, what do we know now? Okay, I've spoken of M3. Now let's talk about R4 and R5. That's human resources management and knowledge management itself. And that's at the national immunization program level. This is not at the health facility level, although it is informed by the findings at the health facility level. Again, I'm simply going to the EVM website and I'm filtering the requirements. So in R4, human resources management, we have these 8 requirements. And I say again that these may be top level requirements that have sub requirements underneath. And sub requirements here are shown, are in top level requirements with sub requirements are indicated with square brackets. So R811 has 2 sub requirements and R816 has 4. Now we're on to R5, knowledge, and apologies again because I don't have time to go through this in any more detail, but I do encourage you to have a look at yourself and please provide feedback or disagreement is also very welcome. If you think that there are errors here, if you think that something is missed or something is unnecessary or the weighting is wrong, then please share your thoughts and we'd be happy to consider that. Likewise, I've illustrated here how we can view the sub-requirements by ticking the Show Sub-Requirements box, and we can see all 891, and we can download all of those as we wish. These, again, set the standard for the vaccine supply chain, and there's the direct link if you want to visit that. Finally, wrapping this up, I go back to the CIP assistant tool because, as I said earlier, it's perhaps the most important part of the whole process. It's where all of this knowledge, this rich data set is going to be used to make real improvements in the vaccine supply chain. If the CIP is not made, then not the whole journey, but a lot of the journey will be wasted. EVM provides a sophisticated CIP assistant tool to enable the findings of the EVM assessment to be converted into a comprehensive and sophisticated continuous improvement planning document and can support the CIP workshop. It actually includes a list of every requirement score from the assessment, and it enables EVM managers to focus in on those areas of poor performance and come up with improvement activities that address those weaknesses. So I've now finished my section, but before I hand over to Srihari to talk about ISC capacity at the facility and individual level, I have just a few slides, I think 2 or perhaps 3, that talk about how the EVM app is useful to build ISC capacity at the facility and individual user level. So EVM is a tool for self-assessment and self-learning beyond the national EVM assessment. And what that means in terms of the tool is that anyone can use this thing called My Facilities. And I show it here in the top right-hand corner. This is what you see when you sign in to the EVM website. My Facilities is a private area that functions exactly like a country, but it is private to the user, private to that person who creates an EVM account. And it can have 1 health facility, or it can have 1,000 health facilities. So anyone can conduct an EVM assessment from A to Z without necessarily needing to do it as part of a national assessment. They can use it as a self-assessment or self-learning exercise. Furthermore, the EVM app can be used for data analysis as well as data collection. And furthermore, key supply chain resources, for example, WHO guidance, learning aids, training materials have been embedded within the EVM app and can be referred to by assessors or those being assessed at the point in which the data is collected or the results are analyzed. And this is what it looks like within the EVM app. For example, on section L30.1, which is about the supervision that's received, a question is asked, during the past 12 months, how many supervisory visits did the facility receive? Now, the assessor is collecting the data by asking that question and recording the results. But there's a little hat here below the question that's green. Now, the green indicates that there is a resource associated with that question. And if the assessor clicks that button, they go to the screen on the right, which shows a list of all of the resources that EVM has provided that can help to interpret or formulate the correct response to that question. And in this case, it's the Training for Mid-Level Managers module 4 about supportive supervision. And this works throughout. There's something like, I think, 350 different supply chain resources that are embedded within the tool. Not only that, but there is also a resource library within the tool. This resource library is a standalone tool, meaning that you don't have to go to a health facility and ask questions to view it. You just download it on your phone, you open it up and you say what criteria and what categories you are interested in, and you will see a list of resources that match your filters. So on the right-hand side, we've filtered for temperature management in E2, and we've asked for human resources category. So E2 C4 resources listed are how to monitor temperatures in the vaccine supply chain, EVM model SOPs, and the immunization in practice module 2. And those can be accessed within the app. You select them, and if you have an internet connection, you can go straight to the website. You can then click download, and you can download an offline copy of those resources. So now I think that's it from me. I hope I haven't overstayed my welcome. I'm going to pass on to Srihari to talk a little bit more because he has an awful lot of experience in this issue, and then Olamide. So Srihari, over to you. Thank you.
Yeah, thank you. Thank you, Dan and Olamide. So colleagues, very happy New Year. So to all of you, I hope I am audible and loud and clear. So so Dan, you can continue the presentation, means showing the presentation. So I have been asked to speak about individual level capacity development. So before I really go to the individual level capacity development, and I'll be speaking more on the learnings from the EVM 1 and how it has been, how the individual capacity development on immunization supply chain was done through the EVM initiative. So we need to understand a little bit on adult learning and how we need to make our behavior of learning as practice. So the learning which we would be making through the EVM, that should convert into a behavior. So then we would have a better learning. So I won't discuss much on all these process, but the adult learning is learning by doing. That means you cannot read something and learn. Even if you have then knowledge learning, but what we are speaking here in individual capacity development in effective vaccine management initiative is all about the skill building. So we can't develop skill without practicing something. So we need to reflect and apply the knowledge what we are expecting to learn. So it only knowledge will not be enough. In the sense, if I give example that as Dan mentioned, there are 900 requirements that need to be fulfilled for a good vaccine management. Now, these 900 requirements, they are more than knowledge, they are more skills. Now, if I have to learn how to do stock management, then I have to learn the stock management. It's not, I mean, I have to practice doing stock management. Then only I can really teach or learn the stock management. Similarly, the temperature monitoring. If I don't do that, then I won't learn. I mean, how to read, how to do the temperature monitoring, how to review temperature monitoring record. Similarly, inventory development for the cold chain equipment inventory development. I can have the knowledge by reading, but if I'm not practicing it, I won't be able to explain others, or nor I will learn individually to replicate the knowledge which I have gained. Similarly, if I talk about the cold chain space planning, now if I don't know what is full immunization per child, then I won't be able to do the cold chain space planning. So there are some critical skills that need to be learned, and these skills can be learned only through practicing that. By doing that, we can learn those skills. Maybe the next slides, Dan. Next, please. Yeah, so here I would come very specific to all these requirement. Now, I am giving specific example of stock management. Now, stock management scores speak some nothing actually. If it is 80%, but then it speak nothing. But there would be individual scores where you need actions. So from the scores, we go to the API supply chain system, that is different records, practices, and these are the standards which are there, then procedures. So I need to know this process and I need to practice this process to each other. So first I have to have those skills and knowledge, then only I can transfer that knowledge and skill to others. And on every day I have to practice those knowledge and skills, then only I can transfer those knowledge, skill, and practices. So with help of technology, we are definitely better equipped to transfer those skills. So if I don't know what are the standards that need to be documented in a vaccine records, and what are those standards as per the EVM, and then I won't be able to disseminate or transfer that knowledge and skills. So in terms of cold chain maintenance, Dan was presenting something on cold chain maintenance. The overall score was good, but in the human resource, one particular area, the score was 20%. Now, why the score was 20%? Because the preventive maintenance of that particular done by the individual was not good. Now, what is preventive maintenance? You cannot teach preventive maintenance by from the book only. You have to demonstrate what is preventive maintenance is all about. What preventive maintenance? So these are individual learning we can do only when we practice. That means by practicing, and we need to see what is our scores, what is the performance of that individual facility, and where I am lacking and how I need to improve. So that is the core in individual learning, and individual learning should also followed by dissemination or transfer of the skill to another person. Then only your learning become more stronger and you disseminate that information and knowledge and skills. Next, please. This would be my last slide. So we discuss about the individual learning and how to sustainably institutionalize this knowledge and the skills. So continuous capacity building of MOH staffs, not doing for MOH. That means if we are demonstrating how to do sampling, it need to be done by them. You can demonstrate, then subsequently they need to practice so that they will internalize it. Similarly, MOH and public health professional, they should do the EVM initiative, they should practice, engage staff at all level. Even the policymaker need to understand for institutionalization of EVM initiative. And you need to have regional and national resource pool so that this pool is repeatedly used for transferring the knowledge and skills. And inter-country exchanges is very critical for individual learning. And this individual who learn the knowledge and skill, they can work as a change agent for improving the immunization supply chain system of the country. And we need to do structured review of the improvement plan, as Dan mentioned, that without improvement plan, EVM is not done. So, and this need to be followed. Improvement plan need to be followed on the how implementation has been done, and advocate the health supply chain system to use the principle of EVM. Then again, your individual learning will be better if you use the principles of EVM for health supply chain. And EVM score to be seen every day by the facility manager. That also helps to better understand your performance, how to improve, where to improve, and how to improve. So these are these are few critical steps for individual learning. So I think I would stop here for the next presenter. Thank you.
Thanks, Harry. Over to you, Olumide.
Dan and Shiari for setting the scene. Hi, everyone. Welcome again to this webinar. We appreciate that you have joined us early in the year, like Dan said earlier, and we hope you benefit from this session. Like Dan said, I'll repeat for those that joined later. This is the last in the series of webinars, but specifically for EVM, we've had previous webinars where we've gone deep into some of these topics. So you can flip or browse the EVM website or the TechNet website to access those, and we'll show. And please come with questions. We would also share slides. Yes. So with the background that Dan and Srihari have kindly said, I'll just bring everything together and also outline how we are trying to do those through high-level EVM capacity building and health supply chain capacity building initiatives to make sure that we can drive forward some of the capacity building efforts. Next slide, please, Dan. So without EVM assessment, without carrying out the first step of the cycle that Dan shared earlier, we won't be able to reinforce our capacity building initiative. So we've seen a good progression from launch in 2019 of EVM2 assessments, leading up to about 39, approximately 40 assessments over the last 4 years. So that's good momentum, despite the lag in 2019-2020 period. At least we're increasing number of assessments now. So this provides opportunities to build capacity of managers in country, to build capacity of consultants, to build capacity of supply chain staff in country to be able to do this work, to carry out capacity management activities and initiatives. So we're hoping that in 2023, you'll see later in the slide how many assessments we are planning. We're hoping that we even do more capacity initiatives through these assessments. Next slide. And so anecdotally and informally, we've been getting feedback on how EVM2 has continued to support initiatives in country. And the initial feedback pending when we would do a dedicated review of the rollout and effects in supply chain improvements. This year, we just wanted to provide this context. As you would see with Dan explaining, 900 requirements is a richer data set than EVM1. It's easier to deploy also, as a lot of people on the slide on the webinar that were part of EVM1, you know that at some point you need to print a lot of materials, but EVM2 is quite handy. You can have it on your mobile phone, share questionnaires, upload, and so it's easier deployment. Also facilitates increased stakeholder engagement through the process, right? Starting from preparation, where you can log in, create your country profile yourself. It helps the countries to come together, review their supply chain data, review their country setup, and start preparing their minds for the assessment. So, and it goes through with the assessment itself, and then CIP development helps to bring as much stakeholders together, like we continue to encourage, like Srihari mentioned earlier, even a broader pool of supply chain stakeholders to engage in this process. Also, the assessment frequency has changed, like Dan was saying earlier. Before, we focused on the national assessments. Now, with the EVM2 more nimble assessment, we can do assessments across the supply chains. The health worker staff can, health supply chain staff at the facility level can actually do assessments on his or her facility, and a manager at the district level can do a specific assessment on critical supply chain functions and monitor the progress of time. So it's assessment, it's a good capacity building and continuous improvement tool, better one than the previous version we have. So we were excited, and of course we'll be reaching out to a lot of you also to contribute to this systematic review of how the rollout has been the last 4 years, so that you can contribute to even how you improve it going forward. Next slide, please. So 4 pieces. So in using the EVM and EVM2 specifically on building capacity development, there are 4 major areas. I know CI has pointed some of those, so I'll not repeat most, but on driving those through the EVM2 itself, there's EVM knowledge building. So doing all this in a webinar is great, but like Dan said, there's a lot of material that develop that would help you to really come up to speed. Also capacity building on how to conduct EVM assessment itself, but through it, use the results to also build more capacity building, and also the CIP is the second bucket. And like Triari mentioned, you know that in as much as you want to have partners, you want to have consultants, firms, like you'll see later, support the EVM process, the ultimate goal is that government stakeholders, not just at the national level, because if you go to any country, when you get to national level, you have a lot of highly skilled managers. As you go down, sometimes that ownership reduces. So how do we localize and institutionalize EVM as the assessment first, but also through the assessment in trend capacity building efforts is also a third bucket, and how we use the framework of the EVM and related frameworks to drive workforce capacity building in country. And you'll see an example of what we're doing as partners to support. So please, let's go to the next slide. So as you will see, like Dan said, there's the technical repository of all EVM materials, and going through the EVM website itself, you can, for each question, you can always go to the relevant materials there. There's a lot of materials that developed to bring stakeholders up to speed on what the EVM can do for you. So please avail yourself of those materials, and we'll continue to update them and ensure to share the links as we have them. Next slide. Part of the capacity building efforts, at least in the last year alone, after travel restrictions were lifted. Of course, before that, we also had a lot of virtual meetings where we did both assessor trainings, manager trainings, and just introduction to EVM2. So that built up to last year when we had a series of face-to-face workshops. We had the global capacity building workshop, which I see a lot of participants online also, which was a hybrid of assessor and manager training. So that was good. And we had regional meetings in 3 regions. In our MENA, in the UNICEF MENA region. So IAPRO and Rosa also had a workshop in Bangkok, and our Latin American colleagues also had a workshop in Nicaragua. So this brought together hundreds of stakeholders, and they were trained on using the EVM app, using the application for assessments, to do both national targeted assessments, and some form of capacity building was also built into it to make sure that they are upskilled to use the EVM effectively to drive sustainable improvements in country. So this year we have events also planned, and we'll be announcing them on Tech and other forums. So please ensure that you keep an eye, because it provides an opportunity, like Thierry mentioned earlier. If we continue virtually, for example, there's only a limit of how much skills we can transfer virtually, but hands-on, doing facility visits, doing some of this face-to-face goes a long way to really reinforce some of those learnings. Next slide, please. Apart from knowledge and capacity building that we've done face-to-face. Like I said earlier, there's not these are the 4 previous webinars, for example, that we had about introducing the EVM, planning and delivery assessment, developing, implementing the CIP, and then looking at the evolution from the origin or the beginning of the EVM in 2009, 2010 to the present time with EVM2. What have we seen? How has the supply chain evolved through EVM assessment output? So these are resources that you can go back and review your leisure time. We'll add this webinar also to that, and you will have access to those. Next slide. So apart from the knowledge and the capacity building itself, we have instituted long-term agreements with 5 institutions. So one of the ways in which there's a difference between rolling out the EVM1 and EVM2 is I want to ensure that we don't just pile countries behind, let's say, a super consultant that continues to fly everywhere without that transferring those skills to stakeholders on the ground. So we are going into agreements with 5 institutions. Based out of Vietnam, ISC, and I think that Amjad is on the call also, based out of Jordan, the Balanzan Institute based out of Burkina Faso, the National Institute of Health and Family Welfare based out of India, and also the Regional Center of Excellence based out of Kigali. So these 5 institutions, and we're hoping to expand in the next couple of years also, are available to provide dedicated support to countries in rolling this out. Now, this doesn't replace in-country partners, doesn't replace stakeholders, government stakeholders on the ground, but reinforces that and strengthens and provides an avenue to provide dedicated support to countries. And you see, in 2022 alone, we had these institutions support 8 countries. So hopefully, as we have some countries, a lot of countries planning EVM this year, some of these institutions will also be ready to support, and you see their contact there. We can always share the contact with you also, so that you can contact them in your EVM plans. Next slide, please. Part of localizing and visualizing the EVM is also that, if you remember, Dan using Dan's word earlier, if you don't develop and monitor and implement your CIP, it's almost like a significant portion of the effort you've done from your assessment is like wasted, because it's through the CIP that you can improve on weaknesses and strengthen your strong points, your success. So what we're doing is developing a CIP development and implementation platform where you can track progress with your CIPs. And if I ask everyone online now, when last you updated your CIPs, or you went through your CIP activities and see what activities have we implemented, usually you get 2 options. It's either once in a while as part of annual work plans and review sessions, and 2, usually when you want to apply for either donor grant, especially Gavi's COP, and then you review. So we're hoping that this CIP implementation tool platform, where you can also download templates, develop your CIP, or upload it and continue to track and report on the progress, will transform how we see the EVM improvement process entirely, to ensure that we can track. But we are not just building only the development and implementation of the CIP, we are also taking this opportunity to build into the tool a systematic and dedicated process mapping, because we want to be able to monitor what time does it take from finalizing an assessment to actually developing the CIP, and what does it take, in what time does it take, and how can we build in more efficiency to that process. So we have that, and then a lot of it is dependent on the presence and functionality of national logistics working groups and subnational logistics working groups. So we are hoping that we're building into the tool also a way to map the presence and the functionality of national, but also subnational logistics working groups. So that's also something that will be in the tool. So anticipate that this year, It's one of the pieces we are also excited about to support you effectively. Next slide. So I'll not go into details of this. Like I said, we're using the EVM framework as our starting point on developing some e-modules materials. As you know, we have a lot of materials, but sometimes they don't come very handy to be used for learning. So we're hoping that we'll develop this year some capacity building online modules to help to increase, update the capacity of countries. And it's along 3 buckets: strategic. So what are the high-level topics that you need to, like every supply chain manager needs to know? Is leadership management, but also technical modules where we'll leverage the EVM framework. Next slide, please. And like I showed in my first slide on the evolution of EVM assessments from 2019. So this is our pipeline through the next 3 years. And you see a longer list in 2023. We'll see where we get to at the end of the year, but we'll be excited that we can actually continue to push the needle. And 2024, you see those countries, and 2025. I think that will be my last slide. Through these efforts, we're hoping that we strengthen not just the capacity of EVM delivering EVM assessments, but using those assessments to catalyze supply chain improvements in countries. I think we'll pass it on for questions now. So I invite Dan and Shuyari back. I think a lot of the questions initially were around if we share the slides. So we'll share the slides. Where can we get key performance indicators for ISC in the document as guidance document for strengthening ISC strategy? We have a lot of documents. One, maybe we'll start from the strategy. There's a Gavi Alliance. So when we talk about Gavi Alliance, not just Secretariat, it's WHO, it's UNICEF, other partners, JSI, CHAI, PATH. There's a supply chain strategy for the next 5 years. And we can share that it would be somewhere on the Gavi website, if not also on TechNet. And there are some key performance indicators there for that strategy, but that can give ideas also on how you can set some performance indicators for your country. The popular DISC indicators also will be somewhere on TechNet that you can also look to see how you can, for ideas about setting performance indicators. But Dan, Harry, if you have additional questions.
Yeah, thanks, Olamide. I think that's a good response. The only one I would add on the DISC indicators, they are available on the TechNet website. You will need to look for the ISC strengthening hot topic. So look for hot topics, view all, and then visit the ISC strengthening area. And you should be able to find the DISC indicators. And when we send the slides around for this presentation, we'll include a link to that for easier reference, because it is a little bit hard to find.
Thanks very much. I think someone has their hand up. Let me see. Ali, please go ahead and unmute yourself. And Ali Oche. Do you wanted to come in?
I've given Ali ability to talk. So Ali, did you want to say something?
Ali, you are able to unmute yourself now. So whilst we're getting ready, while Ali is getting off his mic, is getting his mic up. Shihari, yes, good question about the supply chain improvement plan implementation tool. So it's in development now. As you see the screenshot, the mock-up of the landing page. We're hoping that sometimes in June or July it will be launched. But before that, we want to, from February or March, start working with a few countries to use the template to start reporting. So people get used to that reporting and updating their CIPs before that tool. So a number of us also from the country regions and HQ here will be involved in the process. So please, it's not available immediately. Like Dan said, there's the CIP development tool that's available through the website that can be used. But this will be a virtual online tool that would also be linked to that template that Dan was talking about. Ali, are you available for us now? Okay. Any other questions? You can. Perfect. No, of course, Shiari, you would be part of that, the key stakeholder in that regard. Questions?
I see there's one, another from Sudhir. In EVM1, we used to emphasize 6 supply chain essentials and final outcome of ISC being availability, quality, and efficiency. The outcome is merged now with performance criterion, but what about supply chain essentials? Yeah, well, the supply chain essentials, I'll leave that separately, but talking of the availability, quality, and efficiency, that is measured within the EVM as a kind of a separate perspective on which to view assessment results. You can, of course, view the results in the traditional way via categories and criteria, but you are also, from the exact same results, you can generate your A, Q, and E, availability, quality, and efficiency. But now, talking about supply chain essentials, I think, Olamide, do you want to talk about that one?
Thanks, Dan. So yes, good point. Question to you about this previous EVM and supply chain essential. You remember those were supply chain fundamentals, we call them, if I remember correctly. Now in the new strategy, like I mentioned from 2021 to 2025, we have 6 investment areas also, we call them, and they moved away from the rigid supply chain fundamentals or essentials to more nimble, but not too different. So capacity building and professionalization is a core part of that, which is why these webinars are important, but others include optimization and integration, include supply chain infrastructure, expanding from what we used to have as just coaching equipment to include supply chain solarization, to include using that platform for primary commodities. Also include data management. It used to be data for management, now is stock management and vaccine management as a broad concept. So in the strategy that you would have, now we can share, when we share these slides, the link, you would see how the fundamentals or essentials have evolved to this fundamental, this investment areas, 6 investment areas. But like Dan said, the EVM itself still has that availability, quality, and efficiency that you can have as part of the assessment outputs.
Thanks, Olamide. I think we're just running out of time. I wonder if, Srihari, do you want to have a final word before I wrap this up?
No, I just want to have a thank you, Olamide and Dan. No, I just raise a question: how we are going to do evaluation of sustainable way of doing EVM in a country, because we have some issues. Some of the country, though they are middle income country, they don't have resources to do EVM. So in that way, what is the best way of doing EVM and how we can institutionalize this within MOH? We need to work on that area also. So that's my last comment. Thank you.
Thanks very much, Srihari. It's an excellent point. So it just remains for me to thank Olamide and Srihari for co-presenting with me. And I'll wrap this up by just thanking all of you for giving us your time. We hope you found it useful. We will share the link to the recording on YouTube and the slides very shortly, I think early next week, once the recording is edited and everything's fine. It's also going to be shared in French also. And I encourage you very, very strongly to visit the EVM website, request to create an EVM account, and also view our requirements. Find that under setting the standard. Find out what EVM has to say about capacity building in various contexts. See if you agree with it. If you don't agree with it, that's fine as well. Let us know your thoughts, apply it in your context, and we hope you find it useful. So with that, thank you very much, and enjoy the rest of your day. Thank you.
Thank you. Thank you. Bye.